Welcome back to my channel. It's your girl Laurel, and in today's video I will be showing you how to use STAR method to answer interview questions for NHS healthcare support worker roles. Alright, now this technique is a game changer. It helps you speak confidently and speak as a professional. Okay, now what is the STAR method? The STAR method simply means S, situation, what happened. T, task, what was your duty. A, action, what did you do. And R, results, what happened or what did you learn, or what was the outcome. Right? Good. Now, using STAR method makes you answer questions the correct way and very short and precise. All right? Now, I'll be showing you two examples of how to answer interview questions using the STAR method for NHS healthcare support worker rules. Example 1. Let's take a look at this scenario. You are helping a patient who is in distress. Don't forget, we are using the word STAR method. So we are looking at a patient who is distressed, and you are supposed to do what? Help that patient. What is the situation? Now, the situation is to what? Support an elderly patient who became upset and refused to what? Eating. That is the situation. To help an elderly patient who became upset and refused to eat. Now, if I was an interviewer and I tell you to give me a scenario where you've helped a patient who is or who was in distress. Now, this is a type of example that I will expect from you. You can come up with this scenario and you say, okay, I have been in a situation where I was to help a patient who was upset and refused to eat. Now, how did you handle this situation? Task. Your task was to help that patient calm down and do what? Accept to eat. And say this patient has not eaten for about 3 days. We often see that in the healthcare setting, especially with elderly patients who for days they keep declining to eat. And you know, when you're not eating, your health does what? Deteriorates. Now, you were in such a situation and you were to do what? Encourage the patient to eat. That was the task, to encourage the patient to calm down and do what? And eat. Now, what action did you take? You stayed calm, spoke gently, and listened to the patient's concerns. Why have you been declining food? Why don't you want to eat? All right, you can say it gently. Hello, my name is Laurel, and I'm going to be your healthcare support worker today. And I've brought breakfast for you. And the patient in distress replies, no, I don't want to eat. Take that away. No, no, no. What are you going to do? Okay, calm down. All right. What's the problem? Give the patient an opportunity to explain. Get to know what their concerns are. What's the problem? Why are you not accepting to eat? Is there a problem? Don't you like this meal? Do you want me to get something different for you? You know, ask those questions. Sometimes it could probably be the food given is not what they like. And no one is asking, what would you like to eat, right? So be patient, stay calm, and gently ask what the patient's concerns are, and listen attentively to the concerns of the patient. And then you reassure the patient and what? Explain also the importance of eating something, okay? So that they do not deteriorate. All right. Now, what is the result? The patient eventually agreed to eat the food and thanked you later, or the patient requested for a different meal and you had to go out of your way to prepare that meal. There are situations where a patient will be served toast bread and tea. And this is not something the patients would like to eat. There are patients that they normally want a particular meal for breakfast, and for a while that's what they've been having, and then you present that and they're always upset. I don't want this and I don't want this. And they are not, you know, maybe they just need an extra attention to get to know what exactly they would prefer. And then you say, would you love to have oats? And they say yes, and you give oats. All right. So there are situations like that, and there are situations where they just want tomato soup. So listen attentively and find out what that patient will prefer. Some patients may just get upset with the wrong foods, and they may not just know the best way to explain it. So just stay calm, and get to know what their concerns are or what their preferences are, and then bring it. A patient can tick and want this the previous day, and the following morning they don't want it. Ask, what would you prefer today? And see how you can help that patient eat appropriately. All right? And then, what is the result? The patient finally agreed, okay, to eat either the meal you served or a different meal. And then that problem was solved. The patient got to do what? To eat. All right? Now, the second example we'll look at is teamwork scenario. All right? Teamwork scenario. Now, situation. I was working on a busy ward where one patient needed urgent attention. There are moments where we are working in a ward and you find out that one patient needs an urgent attention, and let's say this patient is being discharged and is ready to go, and now you have to attend to that patient urgently. That's the situation. Now let's look at the task. You were responsible for helping the nurse prepare the patient for transfer. And now let's look at the action. You quickly communicated with the rest of the team, and then you fetched the necessary equipment. Probably there are equipment that the occupational therapists and the physios have recommended for these patients. You get them together, be it a frame, a Zimmer frame, a Sarah Steady, a commode, a walking stick, clutches. Put it together. Personal belongings that the patient came in with. Assemble all of them together, get them ready, and then results. The transfer went smoothly and the patient was on his or her way back home or to a care home, or wherever the patient was transported to. Now this is exactly how to use the STAR method. All right. So when next you are attending an interview and you are asked questions like this, think about a time when you've helped and think about STAR method. Use the STAR method to answer correctly and precisely. All right. I wish you the best in your next interview, and do not forget to subscribe to my channel, share to your friends, drop a comment, like, and subscribe. All right. See you in my next one. Bye.